My name's Jem and I'm studying a Master of Public Health with the University of Queensland. I completed my undergraduate degree in physiotherapy back in 2017 and I spent 6 years working as a physiotherapist across both the Royal Brisbane and Women's Hospital and the Sunshine Coast University Hospital. For me, I went through high school and I was very interested in a career in health, but I guess I'd always thought about more of those traditional pathways in medicine or physiotherapy or dentistry and things like that. But I always had this kind of burning passion and desire for social justice and equity. And it was only more recently that I guess I've learned more about the discipline of public health and more about how that can actually underpin a career, and you can make those changes from not only that individual and community level, but also from, I guess, that greater multi-sectoral policy space as well. When I knew I wanted to go back to university, there were quite a few I was considering at the time. What drew me to UQ was first the fact that the program could be done online, and for someone living in regional Australia, that was quite important to me. The second thing was the ability to not only do research as part of the degree, but also do a public health internship or placement. And I was really keen to get some of that practical experience, as well as the kind of theoretical underpinnings that I would need for my future degree. And finally, I did my undergraduate degree at UQ, and so I already knew it was a great university and I was very keen to experience that again. I think my advice for anyone considering studying public health is to be open to new experiences and open to learning things outside your comfort zone, but also knowing what drives you and what you're really passionate about. Something I've really loved in the degree is that you can tailor a lot of the assessment and a lot of the work that you do to passion areas and focuses, and that has made it so much more relatable and really inspired me to kind of go above and beyond with the learnings that I'm doing. So one of the highlights of my program so far has been the ability to do a research dissertation with the Australian Women's and Girls Health Research Centre. I've learnt so much and I've really got to hone my skills around qualitative research, which is something I haven't previously done before. I think one of the other highlights has also been some of the group work that I've got to do this year. I guess as an online student, you don't have those day-to-day interactions with other students. So getting to work in groups online has enabled me to meet some of the rest of the cohort and form some really meaningful connections. As a part of my degree, I have the opportunity to do a public health placement. I'm actually really hoping that I'll be able to complete this overseas at some place in the Indo-Pacific region, specifically in the area of sexual and reproductive health. At this stage, it's looking like that might be with the Tonga Ministry of Health, which would be an absolutely incredible opportunity, so watch this space.